Hello, my name is Brenna Schatzwell, and I will be presenting to you a project to reduce the risk of Alzheimer's disease among African Americans in our community. The interventions presented will make a positive change in reducing health disparities among African Americans by reducing risk factors for Alzheimer's disease. Alzheimer's disease affects African Americans significantly more than other ethnicities. The incidence is 1.6 times higher in African Americans than Caucasians, and they get the disease at an earlier age. There was a 58% increase in deaths from Alzheimer's disease in California from 2000 to 2004, and in San Luis Obispo County there is a 97% projected increase in Alzheimer's cases by the year 2030. Multiple disparities exist among African Americans, which increases the risk of developing Alzheimer's disease. For example, high blood pressure, diabetes, and cardiovascular disease rates are significantly higher in African Americans and are linked to a higher prevalence of Alzheimer's disease. 80% of African Americans with cognitive impairment have hypertension. African Americans have a 60% higher risk of type 2 diabetes, a condition which contributes directly to vascular disease, which is a risk factor for Alzheimer's disease. Some social determinants of health include reduced access to care, no health insurance, a poorer diet, and lower income and educational levels. The risk of Alzheimer's disease increases as income and educational levels decrease. Alzheimer's disease is the leading cause of disability and morbidity in the United States. People with hypertension and high cholesterol are twice as likely to get Alzheimer's disease, and those with both risk factors are 4 times as likely. The health of the brain is closely linked to the overall health of the heart and blood vessels. The brain is nourished by one of the body's richest networks of blood vessels. By reducing cholesterol, diabetes, hypertension, smoking, obesity, and physical inactivity, it will protect the brain and may help avoid or delay the onset of Alzheimer's disease. Cardiovascular disease has been shown to increase the progression of the course of Alzheimer's disease. Unlike genetic risk factors, many cardiovascular disease risk factors are modifiable. Alzheimer's disease is costly. In the United States, there is an estimated $214 billion revenue or cost in 2014, including $150 billion to Medicare and Medicaid, making it by far the most expensive condition in the nation, according to the Alzheimer's Association. There's also a huge burden on the caregiver. The Alzheimer's Association points out that in 2013, 15.5 million family members and friends provided 17.7 billion hours of care to those suffering from Alzheimer's, and their work is valued at more than $220 billion in unpaid care. Research shows that plaques may be caused by a problem in processing beta amyloid, and risk factors for development of plaques include high blood pressure and high cholesterol. Tangles occur when strands of the protein tau, which gives the brain cells their shape, become twisted, causing cells to die. High cholesterol has been linked to an increased deposit of amyloid beta, or AB. AB is neurotoxic, and the buildup of AB plaques begins a deteriorating cycle of brain tissue inflammation and decreased synapse transmission. The AB accumulation inhibits axonal transport, causing buildup of tau proteins and causing neurofibrillary tangles, leading to cell death. Diabetes is linked to the development of Alzheimer's disease as well. The abnormal insulin signaling that occurs with diabetes is linked to the disruption of tau proteins and the breakdown found in Alzheimer's disease. Cardiovascular disease is linked to Alzheimer's disease by causing damage to the endothelial brain cells. Nearly half of all African American adults have some form of cardiovascular disease. Although there's no cure, prevention of cardiovascular disease is the primary strategy to prevent Alzheimer's disease. Preventing disease and promoting healthy living will give African Americans years of independent living and increase the quality of life. It will also significantly reduce morbidity, mortality, and reduced healthcare costs. Evidence suggests that nutrition plays a role in prevention by reducing risk factors for developing Alzheimer's disease. Healthy nutrition can prevent Alzheimer's disease by offering protective benefits to the brain to help preserve cognition and memory through decreasing cardiovascular risk factors and reducing amyloid beta production. A diet high in omega-3 fatty acids, lean meats, and fresh fruits and vegetables has been proven to reduce the risk for developing Alzheimer's disease. Overall, African Americans were least likely to avoid fried foods and avoid adding fats and butter to food compared to other ethnicities. Poor dietary choices, coupled with a sedentary lifestyle, may help to explain the poor overall health, higher risk for cardiovascular disease, and Alzheimer's disease among African Americans. African American culture may be more likely to view cognitive decline as disgraceful and something that should be kept in the family or part of the normal aging process, thus may not elicit concern until later stages. Resources are scarce in our community and are limited to the Alzheimer's Association and the American Heart Association local chapters. There is a definite need for support in this community. The community health diagnosis includes increased risk of Alzheimer's disease among African Americans related to increased rate of high blood pressure, cardiovascular disease, and diabetes. An increased rate of cardiovascular disease, high blood pressure, and diabetes among African Americans related to poor diet, variations in health, lifestyle, and socioeconomic factors. So you can see, by improving the diet and improving health overall, we can prevent the risk for Alzheimer's disease. This community is lacking educational and support services for African Americans suffering with poor health, chronic disease, and risk factors for Alzheimer's disease. The goal is to increase the quality and quantity of life and reduce premature death among African Americans by reducing modifiable risk factors such as lowering blood pressure, improving diet, reducing obesity, and preventing diabetes and cardiovascular disease. On this slide, I have a graph which represents the prevalence of hypertension among different ethnicities, and as you can see, African Americans have the highest rate of blood pressure. Healthy People is a program of nationwide health promotion and disease prevention goals set by the United States Department of Health and Human Services. It's composed of 467 objectives organized into 28 focus areas, as well as 2 overarching goals. This project is in line with the Healthy People's 2 overarching goals to increase the quality of life and eliminate health disparities. If we can control high blood pressure, diabetes, and cardiovascular disease, we can reduce disparities among African Americans. The specific Healthy People objectives this program is promoting includes to reduce the morbidity and costs associated with, and to maintain or enhance the quality of life for persons with dementia, including Alzheimer's disease, and to reduce the rate of cardiovascular disease in persons with diabetes and reduce hypertension and blood cholesterol levels. Primary prevention is the key. Prevalence of Alzheimer's disease is on the rise and no cure exists. Change is imperative and involves an integrative approach to behavioral and nutritional awareness. Programs will affect risk factor behaviors, and environmental support for heart-healthy behaviors will affect sustainable changes in health risk behaviors. Studies conclude that the most effective interventions include health promotion activities to increase knowledge and awareness of risk factors, strategies to prevent cardiovascular disease, classes in heart-healthy nutrition, and physical activity and environmental changes. Kennedy describes the feasibility of a community-based food delivery service to promote healthy food consumption and promote weight loss among African Americans. All participants received nutritional educational materials and participated in cooking classes utilizing the healthy foods. All participants reported improvements in blood pressure and lowering their BMI. Another study, Aetna tested a disease management program targeting African Americans, combining home blood pressure monitoring and culturally appropriate counseling and education. The program significantly improved self-monitoring and blood pressure control. One more study utilizing a culturally tailored 12-week nutrition and physical activity program revealed that targeted community-based interventions focusing on personal and group wellness have the power to reduce health disparities and improve cardiovascular health for African Americans. The proposed intervention includes community-wide awareness and educational events with classes in heart-healthy food preparation and exercise, social cognitive therapy providing resources for those ready to make behavioral changes, and a community health fair. Secondary prevention will include health screenings and ongoing blood pressure checks. Nutrition education programs may help identify cardiovascular disease risk and provide insight concerning how to adapt healthy lifestyle behaviors. In one study, researchers concluded that nutrition education programs must be developed and specifically tailored, especially for African Americans, to reduce fat intake by emphasizing how to avoid frying foods, choosing leaner meats, and including more daily servings of vegetables and fruit. Common barriers included price and preference of fruits and vegetables, time constraints, cooking skills, lack of knowledge about estimating portion sizes, and fat content in meals. Community-based programs are useful to reduce health disparities because they make use of cultural and social norms that are highly regarded among African Americans, and they are useful in decreasing barriers to health behavior compliance. This is a logic model depicting the program. The Assessment Protocol for Excellence in Public Health, or APEX-PH, includes 3 parts. Part 1 is the Organizational Capacity Assessment, which requires collecting and analyzing data and ensuring adequate communication among all participants. Part 2 involves key members of a community as well as program staff in assessing the health of the community. Part 3 provides for the use of both objective health data and the community's perceptions of community health problems. The APEX-PH process is effective because it often produces recommendations for changes and for improvements in functioning. It is imperative to weigh the cost of initiating any program against the amount of change it will cause. The total program costs are divided by the number of clients participating in the program, and the total program cost per client is the end product. If the benefits outweigh the costs, the program has a net positive impact and should continue. This program has the potential to save millions of dollars on associated health costs in medical care, complications, and caregiving costs. It has the potential to affect a large number of people using a community-based approach. The skyrocketing rate of Alzheimer's disease among African Americans is an epidemic. Variations in health, lifestyle, and socioeconomic risk factors account for most of the disparities. Genetic factors do not appear to account for the large prevalence. Instead, health conditions such as cardiovascular disease, diabetes, and hypertension are believed to account for these differences, as they are more prevalent in African Americans and correlate to the increasing rate of Alzheimer's disease. Science and research has proven the link between these health conditions and Alzheimer's disease. Most of the risk factors contributing to Alzheimer's disease are modifiable, and by reducing these risk factors, we can reduce the incidence of Alzheimer's disease among African Americans. In order to reduce these risk factors and prevent debilitating disease, we need community participation, funding, and support. The community is lacking education and resources needed to implement this program. Together we can make a huge difference in improving the quality of life and improving overall health among African Americans. Thank you.